Processed diets, which are low in fiber, may initially reduce the incidence of foodborne infectious diseases such as E. coli infections, but might also increase the incidence of diseases characterized by low-grade chronic infection and inflammation such as diabetes, according to researchers in the Institute for Biomedical Sciences at Georgia State University. This study used mice to investigate how changing from a grain-based diet to a highly processed, high-fat, Western-style diet impacts infection with the pathogen Cytobacter rodentium, which resembles E. coli infections in humans. The findings are published in the journal PLOS Pathogens. A gut microbiota, the microorganisms living in the intestine, provide a number of benefits, such as protecting a host from infection by bacterial pathogens. These microorganisms are influenced by a variety of environmental factors, especially diet, and rely heavily on complex carbohydrates such as fiber. The Western style diet, which contains high amounts of processed foods, red meat, high fat dairy products, high sugar foods, and prepackaged foods, lacks fiber, which is needed to support gut microbiota. Changes in dietary habits, especially a lack of fiber, are believed to have contributed to increased prevalence of chronic inflammatory diseases such as inflammatory bowel disease, metabolic syndrome, and cancer. In this study, the researchers found switching mice from a standard grain-based rodent chow to a high-fat, low-fiber Western-style diet resulted in a rapid reduction in the number of gut bacteria. Mice fed the Western-style diet were frequently unable to clear the pathogen Cytobacter rodentium from the colon. They were also prone to developing chronic infection when re-challenged by this pathogen. The researchers conclude the Western-style diet reduces the numbers of gut bacteria and promotes encroachment of microbiota into the intestine, potentially influencing immune system readiness and the body's defense against pathogenic bacteria.